Hello, I'm Dr. Nagaraj B Puttaswamy. Hernia surgeries, recovery and lifestyle. This is one of the important subjects we usually talk and try to communicate. Hernia surgeries, after performing laparoscopically, the patient should recover very conveniently. So I already tried to mention and on that, saying that hernia, so a simple inguinal hernia or an umbilical hernia, can be done as a daycare procedure. Daycare procedure is morning. If we do the work patient the previous date or a couple of days before, saying that his general condition is all fine, we try to investigate, if he is a senior individual, we try to take opinions from our colleagues of a physician or a cardiologist or the pulmonologist depending on his medical condition, diabetologist if it is required. All those people will try and do the investigation and trial on those patients before hospitalization. So once the patient is cleared and is given a fitness certificate saying that he can go through the surgery, we do the admission on the same day, operate maybe morning 6-7 o'clock if we admit, and we operate the patient at around 8 o'clock. Patient should be able to walk the same afternoon, maybe in couple of hours time. Once the effect of anesthesia. See, generally we try to do most of the surgical procedures under regional anesthesia, that is spinal anesthesia. The spinal anesthesia may take about 2 to 3 hours following surgery to completely wear off. Immediately after that, the patient will be able to ambulate, that is walk around in the room prescribed. And I don't try and generally catheterize the patient. I don't put the urinary catheter for the patient because I expect the patient to move as quickly as possible and maybe attend to the toilet when the need comes in. So that is the common and easiest way to get out of the bed. And a patient probably has very negligible amount of pain post-operatively. Pain management is very easy for us because we do the procedure under spinal anesthesia. Sometimes if the contraindication is there related to spinal anesthesia, we still do the surgeries under general anesthesia as well. So, but I have seen that a patient who has undergone surgery following general anesthesia experience little bit of extra discomfort and pain in the first couple of hours. But we will definitely manage them with analgesics after the surgical procedure. But whatever said and done, the pain is not a big issue following laparoscopic surgical procedures. The patient recovers so quickly, the patient moves around, and then how early can the patient start to eat or drink? Maybe 3-4 hours after surgery, the patient can start drinking if there is no nauseating. See, why I try and tell about nauseation is because of anesthesia drugs. Whatever anesthesia drugs what we try and use are of little bit of sedative effects. So if a patient is drowsy and he has a feeling of dizziness, possibility of nauseation and vomiting would be there. Once this wears off, the patient can start drinking and even start eating soft diet the same evening. Patient can probably go back to normal eating style the very next day. There is no absolute hindrance about what the patient should eat and then what he should not eat. On the long run, say for example, a long duration in the days to come, I would definitely suggest the patient to consume high protein diet. That will help in enhancing the development of fibrin material so that the mesh will integrate into the body much stronger. So high protein in the form of vegetarian food, people can start eating paneer and related products, and sprouts as we can try in pulses, yes, definitely, of course. But if that can be supplemented with egg, that is the best thing which can be added onto our routine diet. People who are eating meat, fish and other things are definitely welcome to continue their diet style. That will help in the healing process of hernia. And also I try to tell them to be as much physically active as possible. See, how early can a patient resume normal activity following laparoscopic surgery is one big question. What generally patient try and ask me is a patient probably can start moving on the same day, but will get discharged on the same day or the very next day without any doubt. Patient can probably do routine activity. Routine in the sense at least within the house. Maybe go to the kitchen, make a coffee for himself or herself, and start going to the loo without any help, and maybe try and do some gardening activity within a couple of days, and later on maybe go to office on the 3rd or 4th day. This is how quickly the patient can recover. I don't advise a patient to straight away go and start playing tennis or something like that. So what I would probably suggest is to resume high level intense physical activity, getting back to the gym or playing outdoor sport, or maybe do yogas. Maybe they will have to understand their body. Actually, the patient understands their body better than the doctor. That is what I personally believe, and they can decide when to resume these sort of activities. I will always try and tell, if there is some amount of restriction or discomfort, don't try to overstretch your body by doing extensive stretching activity related to yoga. This is what I tell, and this will take about close to a month's time to completely get into normal physical outdoor activities. So as early as possible, within a week's time, the patient can get back to office, move around. I don't suggest them to ride motorbike. They can drive a car within a week's time. But definitely I don't suggest them to ride a bike. So, but later on, after a month's time, I don't have any hold on the patient. I will definitely tell you, listen to your body and go on to do everything what your body can permit. So in every aspect, the patient can do normal activities as any other individual, or maybe what the individual was doing before his surgical procedure which was executed. Okay, are there chances of recurrence following laparoscopic hernia surgeries? I think I should say no. See, if surgical procedure has been executed fairly well and it is performed well, and if the individual listens or practices what I would adjust or suggest, probably there is absolutely no chance that there is a recurrence possibility. See, in case if I have to be following some steps, what is that what I have to follow if a patient has to ask me following laparoscopic surgical procedure? Maybe the patient will be advised not to do extremely strenuous exercises or maybe lift heavy weights immediately after the surgical procedure. Say for example, a big incisional hernia is operated, or a relatively big inguinal hernia with direct inguinal hernias, big ones would be there. If they are operated and if mesh is still yet to get integrated and get fixed, the patient tries to lift 25 kgs of weight at home. Maybe commonly what we try and do is go to the bathroom and a full bucket of water is there. We try to empty that bucket physically because I am alone in the bathroom. So these are common things a patient can go through. What I am trying to tell that, see, don't try to do those sort of activities. So if you try and restrict yourself to do lifting activity and maybe trying to bend too much and try to pick up relatively heavier objects from the floor, these are the common things which I try and tell them to be restrictive of. Walking around, perfectly fine. Climbing stairs, climbing up or down is all fine. Not to lift weight is a common thing. Say many patients, if I train, can I cook on the counter? Yes, definitely you can do. You can cook on the counter, make coffee for yourself, maybe make even snacks for yourself. That is not a big deal. Maybe second, third day upwards. But should we really lift weight, heavy weights of 20, 30, 50 kgs, go to the gym and do some deadlifts? I would definitely not suggest for at least a month's time. If you practice this much and maybe do good dietary activity. Dietary activity doesn't mean to say that you have to gain weight. So again, obesity induces or increases the possibility of recurrence in inguinal hernias or even any sort of hernia or surgery done. So if you try to manage your weight well, manage your muscle strength well, train your body well, possibility of recurrence will be almost negligible.